Right now, as you sit here, something may be happening inside your feet that you cannot feel. Your nerves are quietly losing their ability to protect you. Your blood vessels, the ones supplying your feet and lower legs, may be narrowing right this moment, cutting off oxygen, cutting off the repair crew your body sends to keep your tissue healthy and alive. And here is the number that stops most people cold when I tell them. 100,000. 100,000 Americans lose a foot or a leg every single year because of diabetes complications. Not because they were reckless, not because they did not care, because nobody showed them what to look for. Today, I am going to show you 9 warning signs that appear directly on your feet. Signs that appear months, sometimes years, before any blood test would ever catch this. And sign number 1, the one I am saving for the very end, is the sign that shocks even my most experienced medical colleagues the first time they see it clearly. Stay with me, because what you are about to learn could protect everything you have worked for. My name is Dr. Michael Kent. I have been practicing medicine for over 20 years. I want to be clear from the start. Everything I share today is based on published medical research and my own clinical experience. Please continue working with your personal physician. Bring this information to your next appointment. What I am giving you today is knowledge, not a replacement for your doctor's care. Before we go any further, I need to ask you something. Have you noticed any unusual sensation in your feet recently? Tingling, burning, persistent coldness, any swelling that does not go away by morning? If the answer is yes, type yes in the comments right now, just yes. Capital letters. I read every single comment on this channel, everyone. And what you type today may help someone else watching who is not sure whether to be concerned. Now, let me tell you something that took me years of practice to fully understand. Here is the thing. The system is not built to catch this early. Your doctor, and I say this with deep respect for my colleagues, works with an average of 7 minutes per patient appointment. 7 minutes. That is not a criticism of your doctor as a person. That is a billing and insurance system that rewards volume, not depth. A system that reimburses a prescription written in 3 minutes, the same as a thorough conversation about prevention. In 7 minutes, nobody is carefully examining your feet. And the guidelines? The standard screening guidelines still frame diabetes as something you catch through blood work. Those guidelines were built using data from patients who were already symptomatic, already sick, already in the system, not from people sitting at home, noticing something small, not yet knowing what it means. So if you have been doing everything right, exercising, watching what you eat, taking your medication faithfully, and something still does not feel right, let me be absolutely clear. It is not your fault. You have been doing everything the system told you to do. The system has a gap, and today I am going to help you fill that gap yourself. Now, I want you to meet Harold. Harold is 71 years old, retired carpenter, 6 grandchildren. He's proud of the fact that he built every single piece of furniture in his living room himself. The dining table, the bookshelves, the rocking chair by the window. Harold came to see me not because he was worried. He came because his daughter insisted. She had noticed something on his feet. Something subtle. Something Harold had been explaining away for over a year. I am going to tell you Harold's full story, but I am going to weave it through today's lesson. Because what Harold's daughter noticed is something I need you to be able to see on your own feet too. We are counting down from 9 to 1. And I promise you, sign number 1 is going to change how you look at your own legs forever. Sign number 9. The one almost every single patient has already experienced and written off as nothing. Tingling, numbness, that pins and needles sensation in the feet. Now, I know what most of you are thinking right now. My foot falls asleep all the time. Everyone's foot falls asleep. You are right. Occasional tingling from sitting too long with your legs crossed. That is normal. That is circulation briefly compressed. It resolves in a minute or two. Done. But here is what I need you to really hear. If that tingling is happening regularly without a clear physical reason for it, that is a completely different conversation. Here is what I want you to understand about what is happening inside your body when this occurs. Think of your nerves like electrical wires. Every wire has a protective coating. That coating, called myelin, allows the electrical signal to travel cleanly from your brain all the way down to the very tip of your foot. When blood sugar stays chronically elevated, not dramatically elevated, just consistently above where it should be. It acts like a slow acid, silently eating through that protective coating. The wire still conducts for a while, but the signals start getting fuzzy, unreliable, distorted. That fuzziness, that occasional spark of tingling, that is your nerve coating being damaged, not by one dramatic event, by years of quiet accumulation. The American Diabetes Association reports that peripheral neuropathy, nerve damage caused by elevated blood sugar, affects nearly 50% of people with diabetes. 50%. Half, and it almost always begins in the feet. Think about what that means. Tens of millions of people are experiencing that tingling right now and calling it nothing. The daily habit I give every patient over 60 for this sign, a 20 to 25-minute walk every single day. Not a jog, not a workout, a purposeful walk at a pace where you could hold a conversation, but you are working slightly. Movement drives blood circulation deep into the small vessels of your feet. It is the single best free protection those nerve endings will ever receive. And equally important, if that tingling is occurring more than twice a week without an obvious explanation, write it down. With the date, bring it to your doctor. That documentation changes what your doctor can do for you. Now, let me come back to Harold for a moment. When I asked Harold during our examination whether he had experienced any tingling or unusual sensation in his feet, he almost laughed. He said, "Doctor, I figured that was just age catching up with me. 71 years old. Things are going to feel different." His daughter reached across and touched his arm. Very gently, she said, "Dad, tell him how often." Harold looked down at his hands. He was quiet for a moment. "Every morning," he said finally, "when I first wake up, both feet, takes maybe 10 minutes before it settles down. Both feet, every single morning, for at least a year. Let that sink in." Sign number 8, and this is the one my patients describe as the most distressing, because it does not hit them during the day. It hits them at night, alone in the dark, when there is nothing to distract from it, burning in the soles of the feet, particularly at night. Most patients tell me it is the blankets, the summer heat, being on their feet too long. Here is what is actually happening inside your body. The nerves in your feet have been damaged, and now they are sending incorrect signals to your brain. Your brain receives a heat signal, a burning signal, even though nothing hot is anywhere near your foot. The nerves are misfiring. Picture a smoke detector with a damaged sensor. The building is completely fine, no smoke anywhere, but the alarm is screaming because the sensor cannot tell the difference anymore. It has been compromised. That is exactly what your nervous system is doing. The burning is not coming from outside your body. It is coming from inside damaged nerve tissue, tissue that is in a very literal sense, sending a distress signal your brain does not have a category for. Research published in the journal Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, presenting on average 1 to 3 years before formal diagnosis. 1 to 3 years before the blood test. The habits for sign 8. First, 8 glasses of water throughout the day, spaced out, not all at once. Proper hydration supports your kidneys in processing excess glucose, and it directly nourishes nerve tissue. Second, add more fiber to every meal. Vegetables, legumes, oats, beans. Fiber slows the rate at which sugar enters your bloodstream, which is exactly what damaged nerves need. Less spike, more stability. Sign number 7. And here is the critical part. This is where things stop being uncomfortable and start becoming genuinely dangerous. This is the sign responsible for most of those 100,000 amputations every year. Wounds that will not heal. A blister from a shoe 3 weeks ago, still open. A small cut that has been there for a month, unchanged. Most people wait. They assume it will close on its own. Most small wounds do, but not when blood sugar is chronically elevated. Here is what I want you to understand about why. When blood sugar stays elevated over time, your blood vessels begin to narrow. They stiffen. The very smallest vessels, the microscopic ones that reach into your feet, are the most vulnerable of all. What travels through those vessels? Oxygen, white blood cells. Every component of the repair system your body needs to close a wound. When those vessels narrow, the repair crew cannot reach the site. The oxygen cannot get through. The healing stalls. Picture a major highway at rush hour. Every lane packed. The delivery truck carrying supplies to fix a damaged building cannot move. Everything is backed up. The building sits unrepaired, open to the weather, vulnerably. That is your wound. The highway is your blood vessel network. And high blood sugar is the traffic jam that has been building for years. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Over 100,000 per year. Nearly all of them, were preceded by a small wound that someone believed would heal on its own. Now I need to be crystal clear about medication and this sign. If you are taking any blood thinning medication, warfarin, aspirin, clopidogrel, any anticoagulant, a wound that is not healing requires medical attention within 48 hours. Not next week, 48 hours. Blood thinners can mask the early signs of infection. And in a foot with compromised circulation, infection can move faster than you would expect. If you have a history of heart failure, please speak with your doctor before making significant changes to your fluid or sodium intake. The general advice about staying hydrated applies, but your doctor needs to guide the specific amount for everyone tonight. After your bath or shower, sit down with good lighting. Look carefully at both feet, between every toe, under the heel, along the edges where shoes press. Any cut, blister, or broken skin, clean it with mild soap and water. Apply an antiseptic, cover it. If it has not visibly improved in 48 hours, call your doctor. That is the rule, 48 hours. Sign number 6, this one is hiding in plain sight. Most people walk past it every single day without knowing what they are looking at. Skin discoloration around the ankles. When circulation is compromised by chronically elevated blood sugar, your lower legs and feet stop receiving adequate fresh oxygenated blood. The skin responds. You may see darkening, a deep reddish tone, a subtle bluish or purplish cast around the ankles. Sometimes the skin also becomes thinner, more fragile, less elastic. This is your skin sending a distress signal through color. Think of your blood as the delivery system for everything your body needs. Your feet are the last stop on the longest route in your entire body, the furthest from your heart. When the roads narrow because of damaged blood vessels, the deliveries slow. Then they stop arriving reliably. The skin, starved of fresh oxygen, begins to change. A study published in the Journal of the American Academy of Dermatology found that these visible skin changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months before the blood test. Now, this is where Harold's story becomes particularly important. His daughter, the one who had insisted he come in, she described something to me in the waiting room before I saw Harold. She said, I have been watching his ankles for about 6 months. The skin looks different, darker, uneven, almost like a bruise that never fully faded. She had been quietly observing it for 6 months, worried enough to mention it to Harold, not worried enough yet to fully understand what it might mean. Harold had noticed it too. He told me later he had assumed he was just bruising himself in the workshop. He was not always as careful as he used to be. It was not bruising. The daily movement for sign 6, 5 minutes of ankle circles and gentle calf raises, morning, even sitting in your chair, even lying in bed before you get up. Small deliberate movements drive blood circulation into the feet and lower legs. And if you sit for extended periods during the day, even just flexing your feet periodically, pointing your toes up toward you and pressing them down again keeps that circulation moving. Sign number 5. This one surprises my patients every time because it looks completely harmless. Most people have had it for years and never once connected it to blood sugar. Cracked heels. Now I hear it constantly. Doctor, my heels crack every winter. It is just dry skin. It is the weather. And for some patients, seasonal cracking in dry weather, that is often exactly what it is. But here is what I need you to pay close attention to. When your heels are cracking badly in summer, when no amount of moisturizer helps, no matter how consistently you apply it, when the cracks are deep and slow to improve, that is a different situation entirely. Diabetes damages the autonomic nerves. These are the nerves that control the automatic background functions of your body. The things you never have to think about, your heart rate adjustments, your digestive speed, and among those automatic functions, the regulation of moisture and sweat production in the skin of your feet. When these autonomic nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose their natural moisture from the inside out. No topical cream can replace moisture that is not being produced because the problem is not on the surface. The problem is in the nerve signals telling your skin to stay hydrated. Think of your skin like a wall made of bricks and mortar. When those autonomic nerves are damaged, the mortar starts breaking down from the inside. Cracks appear at the surface. And those cracks in the skin of your feet are not cosmetic. They are entry points. In a foot with poor circulation, an infection that enters through a cracked heel can become serious faster than almost anything else I see in practice. The American Podiatric Medical Association identifies chronic treatment-resistant heel cracking as a significant clinical indicator of autonomic neuropathy in seniors, a condition directly associated with long-term elevated blood sugar. Habit for sign 5. Moisturize every foot every night before bed. A high-quality foot cream or pure coconut oil both work. Apply thoroughly to the sole and heel. But here is the one I always emphasize. Never apply moisturizer between your toes. That trapped moisture creates exactly the warm, damp environment that fungal infections need, sole and heel only. And 8 to 9 glasses of water throughout the day. Not optional. Not when you feel thirsty. Thirst is a late signal. By the time you feel thirsty, your body is already asking for what it needed an hour ago. But before we go further, I want to pause here. If this information is reaching you in a way that feels important, if you are recognizing something in your own experience or in someone you love, hit the like button right now. It takes 1 second. And what that one tap does is tell the algorithm that this content matters, that it should be shown to more seniors who are searching for answers. Your one tap could reach someone sitting at home right now who desperately needs to hear this. All right, let us keep going. Sign number 4. And this one is more serious than most people realize, because it is not just a story about your feet. It is a story about your kidneys happening at the same time. Persistent swelling in the feet and ankles. I know what most people tell me. I stand all day, I travel, my feet are tired, occasional swelling is completely normal, and you are right. Swelling from a long flight or a full day on your feet that should be gone by the following morning after a night of rest. But if your feet and ankles are consistently puffy when you wake up in the morning, if you leave deep sock indentations every evening, if you press your fingertip into the swollen area and the indentation stays for 3, 4, 5 seconds, that is called pitting edema. And that changes the clinical picture significantly. Here is what is happening inside your body. Chronically elevated blood sugar damages the kidneys, and your kidneys among their many critical functions. Regulate your body's fluid balance. When kidney function is compromised by years of elevated glucose, fluid accumulates in your body, and physics does the rest. Fluid goes to the lowest point, gravity, your ankles, your feet, your lower legs. Think of your kidneys like a filtration plant, processing millions of gallons of fluid every day. When high blood sugar damages the filtration membranes, the system backs up. What cannot be processed accumulates, and it pools in the lowest point of the system. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema, visible swelling in the feet and ankles, is frequently the first sign that kidney function is being stressed. Now, this is absolutely critical, and I want to be very direct. If you have any history of heart failure, or if you are currently taking a diuretic medication, a water pill, and you notice new or worsening swelling in your feet, please contact your doctor the same day, not at your next scheduled appointment, the same day. Edema in the setting of heart disease requires immediate professional evaluation for everyone else. When you rest, elevate your feet above the level of your heart. Even a pillow tucked under your ankles makes a meaningful difference. Reduce sodium intake. Many packaged and canned foods contain shocking amounts of sodium. 1 can of soup can contain over 900 milligrams, nearly half the daily recommended limit in a single bowl. Read labels. It matters more than most people realize. Sign number 3, and among my male patients in particular, this is the one I see misdiagnosed most consistently. Severe stabbing pain in the foot, especially at night. By the time men come to me with this sign, they have almost always been living with it for months, masking it, usually with ibuprofen or similar medications taken regularly. They tell me, I figured it was arthritis, an old sports injury. My foot just aches sometimes. And let me be honest, sometimes that is exactly right. Joint pain after 60 is real. Arthritis is common. I am not dismissing that. But here is what I need you to understand. When nerves are damaged by chronically elevated blood sugar, they do not always become quiet. Sometimes they become hyperactive. Instead of going numb, they start firing random, intense electrical signals that your brain interprets as severe pain. Stabbing, electric, like a current being sent through the foot without warning. And this happens most powerfully at night, when your brain has fewer competing sensory inputs, when everything else is quiet. That is when the misfiring nerve signals dominate. Think of a car alarm damage in an accident. Every few minutes, it triggers for no reason. Nobody is near the car. The alarm is simply broken, sending signals it was never supposed to send. That is what a damaged nerve does. It sends alarm signals when nothing is actually wrong. The pain is completely real. The source is nerve dysfunction, not tissue damage from injury. And ibuprofen does not repair a damaged nerve. Taking it regularly only masks the signal your body is sending, a signal you actually need to hear. A landmark study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with type 2 diabetes, and it is consistently misidentified as arthritis or age-related joint degeneration, sometime for years. Now, this is when I came back to Harold during our appointment. I asked him directly, Harold, have you ever experienced a sharp pain in your foot at night? Not soreness or aching. I mean sharp, intense, like something electric. Harold was quiet for a long moment. Then he said, yeah, once or twice a week, the left foot. I wake up from it. I thought I was just sleeping on it wrong. His daughter turned to look at him. She had not known, he had not mentioned it because he did not think it was worth worrying anyone about. So here is what Harold had been living with silently for over a year. Every morning when he woke up, both feet tingling that took 10 minutes to settle for 6 months on his ankles. That darkened, uneven skin his daughter had been quietly watching. And once or twice a week, the left foot. A sharp electric pain waking him from sleep. 3 signs, all pointing in the same direction. And Harold had a reasonable explanation for every single one. Think about how close this came to being missed. The morning habit I give for sign 3. Before you get out of bed, before you put any weight on your feet at all, 5 minutes of gentle movement. Flex your feet. Circle your ankles slowly. Gently pull your toes back toward your shin. Get blood moving into the feet before you stand. This simple practice can reduce morning nerve pain significantly for many patients. And in the evening before bed, 3 minutes of gentle massage along the sole of the foot and up toward the ankle. Light circular pressure. Your nerves respond to gentle, consistent stimulation. This is not a cure, but it is real support. And the patients who do it consistently report meaningful improvement in night pain within 3 to 4 weeks. Now, week 1 of any protocol like this, I want to be honest with you about what to expect. Week 1 is awareness. You are learning to look at your body differently. That takes effort and attention. You will probably forget to check your feet some nights. That is normal. Start again the next night. Week 2 is habituation. The foot check becomes part of your routine. You start noticing things you walked past before. This is the week most of my patients start calling with questions. Good questions. Questions that lead to early conversations with their doctors. Week 3. This is the week I look forward to, because patients start telling me they feel like they finally understand what their body has been trying to say. They have notes, they have dates, they have observations their doctors had never heard from them before. And week 4, bring everything to your doctor. Your notes, your dates, your observations. A patient who walks into an appointment holding documented observations with dates changes the entire dynamic of that conversation. Your doctor can do far more for you when you give them this kind of specific, organized information. I know this feels like a lot, but ask yourself honestly, is 15 minutes of attention each day worth protecting your ability to walk to your grandchildren, to stand in your own kitchen, to sleep through the night without pain waking you? Most people quit after 3 or 4 days. They try one thing, it does not immediately fix everything, and they stop. But the ones who build these habits and sustain them, they are the ones who catch things early enough to matter. They are the ones who call me 3 months later sounding like different people. Sign number 2. This one tells me how far the damage has progressed. When I see sign 2 in a patient, I know we are not in early stages anymore. Persistently cold feet. Now, everyone has cold feet sometimes. Cold rooms. Sitting still too long. Circulatory slowdown from extended inactivity. All of that is real and normal. But here is the clinical distinction. Are your feet cold regardless of the temperature around you? Cold in the middle of summer? Cold under 2 or 3 heavy blankets? Cold even when the rest of your body feels warm? That is a completely different situation. When circulation has been severely compromised by chronically elevated blood sugar, the blood vessels in your lower legs and feet have narrowed and stiffened to the point where warm blood cannot reach the extremities in sufficient volume. Think of the heating system in an old house where the pipes inside the walls have corroded from the inside out over 30 years. The furnace is running perfectly, generating plenty of heat, but the pipes are so narrowed by corrosion. The heat cannot reach the far rooms. Those rooms stay cold no matter what temperature the thermostat says. Your feet are those far rooms. Your heart is the furnace, and your blood vessels are the pipes that have been slowly narrowing, not from neglect, but from years of elevated blood sugar silently doing its work. The American Heart Association identifies peripheral artery disease caused by progressively narrowed blood vessels as affecting over 8 million Americans. And diabetes is the single largest modifiable risk factor, persistently cold feet regardless of environment. This is one of the most consistent early signs, the best response to sign 2. And I want to be very specific here. A 30-minute walk at a brisk pace, not leisurely, arm swinging, slightly breathless, every single day. This level of cardiovascular exercise forces blood circulation into the feet and lower legs. It strengthens blood vessel walls. And with consistent practice over 8 to 12 weeks, it can partially reverse early narrowing in some patients. If 30 minutes feels impossible right now, start with 10. 10 minutes is infinitely better than 0. The goal is consistency, not perfection. Start where you can, build from there. And now, sign number 1. I promised you from the beginning that this one would surprise you. That it was the sign that shocks even experienced physicians who have not been specifically trained to look for it. Here is what I need you to do right now. If you are watching this at home, look down at your lower legs. Look at the top of your feet. Pay close attention. I will explain what you are looking for. Loss of hair on the lower legs and the tops of the feet. Now, before you move on, I know what the first reaction is. Doctor, I have always had thin leg hair. My family just has fine hair. That is just aging. And I want to acknowledge that, honestly. Leg hair does thin with age. That is real. But here is the clinical distinction I need you to understand. When hair loss on the lower leg and top of the foot is noticeably more complete than the hair on your upper leg, when it has become progressively more sparse over the past 2 to 4 years, when it appears alongside any of the other 8 signs we have covered today, that is not a genetic story. That is a blood vessel story. Here is what is happening beneath the surface. Hair follicles require a steady, consistent supply of oxygenated blood to function, to produce a single hair when circulation is significantly impaired by long-standing elevated blood sugar. The follicles in the feet and lower legs slowly stop receiving what they need. They do not die suddenly. They do not give a warning. They simply, gradually, stop producing. Think of your hair follicles like small plants in a garden that depends entirely on an irrigation system. When the irrigation pipes that feed one section of the garden slowly narrow from corrosion over the years, those plants do not die dramatically. They just gradually stop growing. The patch becomes sparse, then bare, and from a distance, you might not even notice when it happened. But it is not genetics, it is irrigation. And the irrigation problem is your blood vessel health. Research published in the journal Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. The researchers describe it as a reliable and frequently overlooked clinical sign, and know that physicians are specifically trained to examine for it during a complete foot assessment. Frequently overlooked. Because unless you know to look, you will not look. Now, back to Harold. Remember what his daughter had noticed? What she had quietly been watching for 6 months before she finally insisted he come in? It was not the morning tingling. Harold had not told her about that. It was not the night pain. He had kept that to himself too. What she had noticed was the tops of Harold's feet and the lower half of his legs. She described it to me this way. She said, when he wears shorts, I can see that the lower part of his legs is almost completely smooth now. And the tops of his feet, it used to not be like that. I noticed it maybe 2 years ago that it started looking different. I thought maybe I was imagining it. She was not imagining it. And she had been watching it change for 2 years before she trusted herself enough to bring him in. Harold's fasting blood glucose that morning came back at 221 milligrams per deciliter. 221. The threshold for a diabetes diagnosis is 126. Harold had been diabetic, likely for over 2 years, experiencing warning signs on his feet the entire time, waking up to them every morning, living alongside them, and explaining each one away. But here is the part of Harold's story that matters most to you today. We caught it. Because his daughter trusted her observation because she insisted. 4 months after that first appointment, Harold called my office. His daughter was with him. I could hear her in the background as he spoke. He said, "My morning readings have been between 114 and 128 for the past 3 weeks. I walk every day now. I changed what I am eating. I check my feet every single night." He paused for a moment. "I built a bookshelf last week," he said, "for my youngest granddaughter. First time I had been in my workshop in over a year. I did not realize how much I had been pulling back." His daughter's voice in the background, she was crying. Now, I want to be honest about Harold's outcome. His results were on the better end of what I typically see. Not everyone responds this quickly. Some patients need medication alongside lifestyle changes. Some have more advanced damage that takes longer to address. Everyone's situation is individual. But the direction, the possibility of moving toward better numbers, better circulation, better mornings, that is available to almost everyone who catches this early enough to act, and you can catch it early. That is what today was about. Here is what I want you to do tonight. Not tomorrow night, tonight, after dinner. Sit down somewhere comfortable, remove your shoes and socks, get good lighting, and look carefully at both feet. Look between every toe, look at your heels, look at the skin around your ankles. Look at the lower half of your legs and the top of your feet. Ask yourself these questions. Is the hair noticeably thinner or absent on the lower half of your legs compared to the upper half? Is there any discoloration around the ankles, darkening, redness, a bluish or purplish tone? Is there any wound, blister, or broken skin that has been present for more than 1 week? Is there swelling that is still present when you wake up in the morning? Is there tingling, burning, or stabbing pain that has become a regular part of your nights? Are your feet cold even when the rest of your body is warm? Write down what you find with today's date and bring that list to your next doctor's appointment. A patient who arrives with a documented list of observations with dates gives their doctor something they can actually work with. You built the life you have, the independence, the ability to be present for the people who need you, the ability to do the things that make you feel like yourself. Do not let something as detectable, as identifiable, as manageable with early action take any of that from you quietly. Not now. Not when you have just learned what to look for. If you watched this entire video type, I finished in the comments right now, and then to share this with one person, your husband or wife, your adult child, a friend who lives alone and does not have someone looking out for them, a neighbor who has been complaining about foot pain and is not sure what to do about it. That one share could be the moment that changes the trajectory of someone's health. Someone who does not yet know what their feet are trying to tell them. And next week, I am going to tell you about something most people do every single morning. A habit that has been accepted as standard wellness advice for decades. A 2023 study published in the Journal of Clinical Nutrition, following over 12,000 adults for 8 years, found that this specific morning habit was significantly associated with accelerated blood sugar dysfunction in adults over 60. The finding is the exact opposite of what most people have been told. You will not want to miss that. I am Dr. Michael Kent. Stay aware, stay proactive, take care of those feet. I will see you next week.